Okay, so we will finish off with section 7 and section 8 of Harrison's 21st edition. And in section 7, the very first chapter, that 51, has been changed, or it has been restricted to only interstitial cystitis bar bladder pain syndrome. This is taken as a whole new topic, and author has been changed. So wherever, if you can see the chapter starting where the author has been changed, the whole chapter will be reformed. Here the chapter has no resemblance to the chapter which was there in the 20th edition, interstitial cystitis and other dysuria and all, but this is completely different. There is no comments on dysuria or anything. So the whole chapter needs to be read completely. It appears more like restricted to the interstitial cystitis bar bladder pain syndrome, where everything, diagnosis to treatment, epidemiology, everything has been taken care here, rather than symptomatology. It's more like a single disease discussion, and the whole chapter you have to read. After that, 52 and 53 chapters, there are no changes as such. Azotemia chapter is not having any changes. Fluid and electrolyte disturbances also you can go through safely without any problem, but I would advise you to go through the treatment parts again, because there are few sentences or words which have been placed from here to there, but not gross changes in this chapter also. The differences begin to start in the chapter of acid-base disorders. Till then everything appears same. The treatment part also the same thing, whatever was earlier, it was there. The same things are repeated. There is nothing big changes in that. In hypercalcemia and hypocalcemia also there is no much change. But in chapter 55, acidosis and alkalosis, there is a lot added in the, not in the diagnosis part. In the treatment part they have added lots of paragraphs, and at some places they have changed the meaning of that sentence. So you have to read the treatment part of all the metabolic acidosis, alkalosis, respiratory acidosis and alkalosis. You can see here that in treatment of metabolic acidosis also they have changed in the DKA part. Here they have given pH is less than 7. In a few steps forward they have given it as pH less than 7.1. And here also in the ketoacidosis diabetic part they have included SGLT2 receptor and SGLT2 antagonist, because their use has been increased nowadays. So that part is different. DKA ketoacidosis presentation and treatment also has been little changed. Other than that, salicylate induced acidosis, they have in the bracket they have given what is the actual HCO3. This was not there in the previous one. It was like, if renal failure prevents rapid clearance of salicylate, hemolysis should be performed against a standard bicarbonate dialysate. Here they have given the value. So similarly in every part of this treatment part there is a slight change. Even in ethanol glycol they had given that hemolysis is indicated when the arterial pH is less than 7.3 or the osmolar gap exceeds 20 milliosmol per kg water. But here they have given some 3 or more extra points, like the end organ damage, CNS manifestation, kidney disease, high anion gap acidosis is present. So these 3-4 points have been added in the all treatment parts are similar. There has been a little bit addition to the treatment parts of all the acidosis and alkalosis chapter. This also the non-metabolic treatment. There is a lot change about type 1, type 2, type 4, and also in the end they have added some more points, like documented isolated hypoaldosteronism should receive fluorocortisone, but the dose varies with the cause of the hormone deficiency. After this, there was a sentence that this is contraindicated in some type of aldosteronism, but here that sentence has been removed. And this agent should be administered very cautiously and in combination with furosemide in patients with edema and hypertension. In turn, edema and hypertension because of the possible aggregation of these conditions. It is more like in heart failure with hypertension, but that one was finally patients documented isolated, but that one was different. So compared to previous edition, this edition has little more changes in the treatment of non-ion non-anion gap metabolic acidosis, that is page number 365 is changed. And again the same thing, the treatment part of metabolic alkalosis also they have added something new in the end, and actually the therapy for Liddle syndrome was not there in the end of metabolic alkalosis, but they have added here that it should be amyloid triamcinolone, but this is somewhere else also, you can read it somewhere else also. Same in respiratory acidosis and respiratory alkalosis treatment also, there are few wordings which have been added, or the placement of wordings has been changed, but otherwise not big changes in respiratory alkalosis and acidosis. But metabolic acidosis and alkalosis treatment part you have to read, that is very important. So next section, alterations in skin, as you know there will not be much change. Only thing is that the psoriatic arthritis treatment part, the table has been changed, really good, that made me really interesting, because see, this is how it should be, like treatment part, the table 57.4 has become like anti-TNF alpha agents, so anti-IL-12 and anti-IL-23 agent. So this will make you remember easily rather than the previous editions table, which was very bizarre. So go through 57.4, which is very important. Other than that, there is absolutely no change in any of parts, rather than like maybe little more in like this pityriasis rubra pilaris, there was only anti-ILA antibodies. Now it is anti-ILA receptor antibodies, some finer tuning, because there are the number of agents which are available are increasing. So other than that, the section 7 is almost untouched, and obviously it doesn't need to be touched anymore. It is skin lesions are still the same, the treatment also slightly increasing or changing, but other than that it will be not be changed. So section 7 and section 6 we discussed, but not much changes in the section 7. Section 6, one chapter is changed, and purely metabolic acidosis and alkalosis you have to read. There is no other issue about that, and we will discuss about the hematological alterations in the next discussion. Thank you.